It's excellent news that we've been able to secure additional vaccines to be sent to us. Today is the last day of vaccination, so we will have used up all our vaccines by today. So it's perfect that we are receiving an extra batch of Pfizer vaccines tomorrow and then an additional one later on. That means that we can now call on and invite other members of the public to come and have their vaccines, and we can also guarantee that the first cohort of people who had their vaccines at the beginning of the week will be guaranteed their second dose within 21 days.
Minister, we're all aware of what a harrowing time it's been for the community, with so many COVID deaths and high numbers of people admitted into the COVID ward and CCU. Can you just give us some insight into how staff are coping under such difficult circumstances?
This is an extremely difficult time for staff. We have a lot of patients in the Victoria COVID ward. We have a lot of patients in the CCU, patients who are ventilated. People who work in the hospital, clinical staff, work 12-hour shifts. People who are working in the CCU are not only working in demanding conditions because they have a full ward of patients who are ventilated, and it's complicated treatment, but remember that they also have to undertake this task in full PPE. This is not an easy task. It's demanding, both physically, and it's also very draining psychologically and draining mentally. And if we think about the pressures that have also been applied throughout our ERS sites, this is also very difficult. Just imagine yourself as someone who works in Montalvernia, and you're working on your particular floor, and you've had this relationship with residents for a long time, and now unfortunately residents at Montalvernia have passed away. Our staff have a relationship with those residents, and they also feel, in addition to their exhaustion from the amount of work that they have to put in, then they're also saddened by the loss of the residents, because these residents over the years become their friends. We have deployed therapeutic support to all our staff. The care agency counselling and therapeutic team is providing frontline resilience therapeutic support to staff at the care agency and also to staff at ERS, because we recognise that everyone at ERS, in addition to being exhausted from their hard work, are also emotionally exhausted, and we want to make sure that we're there to support them as well. Therapeutic support is also being offered to the hospital by the government's therapeutic team as well. So we're looking after our staff welfare as well.
Well, the community is planning a clap at 8 o'clock tonight. I imagine that'll be a much welcome morale booster for the staff.
I'm sure it will be. I only wish people could understand the tremendous amount of work that's put in by all the frontline clinical staff with their full wards, having to work long hours, having to work with PPE, and having to deal with the emotional effects of what they're seeing, what they're experiencing, and everything that they're having to do. I cannot thank the staff at the GHA, at ERS, or the care agency enough for all the work that they're putting in to make sure that they safeguard everyone in our community.